Hello, this is Dr. Bob and Debbie DeMaria. I'd like to welcome you once again to a half-off health program. And this evening, we're going to talk about a couple conditions that are very serious, and you don't really hear too much about them unless you maybe go on the internet and you had somebody that's actually had an injury or trauma. The first item that I'd like to talk about this evening is concussions. And concussion is trauma or injury that's occurred to the skull, which impacts the brain. And I know that today, I was just recently at a seminar and they were talking about concussions. And my whole point today is not so much even diagnosing what happens with a concussion, but what happens when someone comes into your life and they have been traumatized. So I really like you to pay attention if you have a child that's learning how to ride a bicycle. They should be wearing their helmets. Also, if you have a child that plays soccer or any other kind of sport, rather it could even be volleyball, when they fall down and their head hits a hard surface. Obviously, we know that football is probably one of the most common sports. When I say football, I'm talking about American football, when you wear a helmet and they have this clash that is constantly going on. And what's occurring is there's literally trauma and injury that's happening to the person's, to their brain. And I don't have a brain today to show you, but you know what? When you look and think about the brain and the cortex of the brain, it'd be very similar. And when I use the word similar, you get the idea that it's pliable. The brain's made up of fat, it's made up of water, it's made up of fluid. A part of what I really want you to understand today is it's inflammation. And I really want you to stay focused about what I'm saying. Because, see, you could have a mild trauma to the skull that can cause major challenges to your brain if you're choosing the wrong diet. Here's what's going on. This is the spine, of course. This is the cervical spine. Let's just say that the brain is inside of the skull and there's trauma, however it occurs. Well, I've seen and witnessed and listened to researchers talk about even when a child or adult head is taken forward and backwards as the head is hitting the floor or another object, there's trauma that results in inflammation. Now, so many of you have heard me talk about diet before. When you consume sugar, your body has more potential to have inflammation, which means a slight trauma or injury can cause more of a negative impact. See, if your skull is really only this big and your brain moves on the inside and it's ever so slightly injured, what's going to happen to it is that part of the brain is not going to function optimally and you could have a headache. So oftentimes when a person's traumatized, they'll ask them, did you lose consciousness? If you lose consciousness, you know that that brain has been severely traumatized. If after a sporting event, your child says to you, you notice that they've fallen down and they've hit their head and they've had a headache, there's been trauma that's occurred to that child. Now, I wish I could give you a very simple remedy of what you could do. I would have to tell you that rest would be really important because the brain and the outer coverings of the brain and the spinal cord. See, your brain is covered with material, pia mater and the dura mater, and what happens is that those can be inflamed, and oftentimes those can be injured. So you're going to want to drink water, because see, water is going to help purify the system. That's very significant. I would actually have them make sure they're eating some red, yellow, or orange green peppers, or red, yellow, orange bell peppers, some tomatoes, cucumbers, because see, you're going to be putting real vitamin C in their body, promoting health and healing. This might sound a little silly to you, but you could actually change water temperatures. You could put their feet in some colder water and it'll draw the blood from the brain. Then you can release that, causing a constant blood flow. I'm just trying to give you some ideas of some things you could do. Probably what's so significant is to have a lifestyle of consuming the right foods that will minimize damage caused by trauma. So in this hand, I'm holding a vegetable oil. This is actually an omega-6 oil. And if you use this artificial, commercial-grade, thin, actually devoid of all nutrient oil, and you have any type of slight trauma, you're going to have more inflammation in your body. But if you incorporate a tablespoon of flax oil per day per 100 pounds, or if you're taking some kind of marine oil that is anchovy or sardine-based oil, that's going to help minimize inflammation that's going to occur to the brain, and it's going to also impact the negative, reduce the negative impact on the spinal cord. So, Debbie, if you wouldn't mind holding the spine for me right now. What I'm going to do is your spinal cord is inside of the column. So what I'd like you to understand is when you have trauma and injury to the head, this spinal cord, the breathing center is right in here, right in the lower part of the brain stem. So you could have people that have trauma and injuries to their brain that impacts their spinal cord. So you might say, okay, Dr. Bob, what do you suggest? Well, if you have a child that comes home after a sporting event and you weren't at that event and they said they hit their head and they're having issues with seeing, vision, it might not be a bad idea to take them to a skilled emergency center, not just any emergency center. You want to go to a larger one that you know has the ability to do possibly an MRI. Do they have any kind of vomiting? Why is that? Because the vomiting can occur because the brain has been traumatized and various nervous system centers in the body, which affect the nerves that go down into the digestive system, could be impacted. So I'm trying to give you some PM, some preventative maintenance. And maybe if you know somebody has been really severely traumatized and you go to the emergency room, it'd be really wise to ask them, and I normally would not say this, they might even need to take an NSAID, that's a non-steroidal anti-inflammatory drug or medication, to help them for that moment to keep the blood thin, because you do not want permanent damage. Now, what I see in my practice oftentimes are minor type of concussions from motor vehicle accidents and sports injuries that result in headaches, maybe even some memory lapse. So very interesting. Anytime you want to add something, because I know that you're probably thinking as a mom, what would a parent want to know?
Well, there's two things that I was thinking. And the first is, if I have an infant that is young and falls down the steps and hits their head, they oftentimes are not able to communicate to me what happened, what's hurting, because of their limited vocabulary. What would you do in that particular case?
I would definitely, the very first thing is I would look at their eyes to see if their eyes are impacted in a negative way, shape, or form, because I think that's going to be really important. See, like you just said, children can't talk about headaches, but if they become very lethargic, you have moments of time, and I'm not trying to have anybody right now to become paranoid and, oh my gosh, my child just fell down and what is going on. You know, it's always wise to watch. Look at pupil size. Look at the eyes, because see, the eyes are the windows to the soul, and if those eyes are dilating, if they're changing shape that's out of the normal for them, something else that is not common, but we always ask this when somebody's involved in a motor vehicle accident, are they having difficulty in starting or stopping to urinate? Because your urinary system is impacted by brain and spinal cord trauma.
Wow. And the second thing is that I was going to ask, I know a long time ago, when anyone had injury to the head, they always wouldn't let you go to sleep because they wanted to observe to see what was going on. So how is that relation? Like, why did they not want you to go to sleep? And is that still what you would want to do today?
Well, you know, physiology hasn't changed. I think back in those days, they did not really have access to have an MRI. And I'm not telling you every time somebody is traumatized to run off to have an MRI. But you could have a slow bleed You could have a slow bleed that would be very insignificant at first, but if they could lose consciousness. And you know, people have trauma all the time to their spine and all the time to their skull. So if you have somebody that was traumatized and they become very sleepy, like immediately now, sometimes the brain can go into shock and it's going to be in a standby. It's never wrong to have an assessment. Check to see if they have numbness in their fingers, numbness in their toes, any vision impairment, any speaking impairment, and any memory impairment. And I know that especially during the fall when you have these young high school players that are really hitting their heads hard against each other, it'd be very just wise of you to have an assessment by a skilled healthcare provider. So number one, as far as PM, minimize sugar. Make sure you're using some flax oil. Flax oil helps take away pain and inflammation. Dairy causes pain and inflammation. Always ask them some questions on how they feel. Nausea, urinating, memory, those are all significant. If you do see any kind of projectile or continuous vomiting, I would definitely have an assessment by a very skilled, experienced neurologist or ER physician. We're going to take a short break and we're going to be right back. Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our Half Off Health program. And this evening, we're going to talk about a very interesting phenomena that's occurring in our society today. And because I am a chiropractor and I have a degree in spinal engineering and I focus in the spine and the nervous system, we're going to talk about what happens to your neck with technology. I know that many of you, probably if not most of you, have some type of handheld electronic device to communicate with. In other words, you have a phone, whether it be an analog phone or a smartphone. And what we're seeing today, more now than ever, is that people, and all you have to do is look around, spend an enormous amount of time on their phones, using both thumbs or one thumbing, and they're texting to each other or to other people or to groups. So this is very serious, especially for younger children. See, as the twig is, the branch will grow. What does that mean, Dr. Bob? That means if you have a child that is doing a lot of texting and visual work with their hands at a close proximity, their neck is going to be very flat. Now watch what I'm going to show you because this is significant. A normal neck is 45 degrees. That's a normal neck curve. We start seeing major challenges when that same neck zeroes out. That means there's no curve. Here's what we're seeing. I don't want to use the word epidemic, but we're seeing an increased number of young people who are coming into our office when we're taking films of them, that their head and their neck is in a very forward position. What that does is that will literally create pressure on the spinal cord. So this head is in this forward position like this. That means the spinal cord is in the forward position. You see, we've not ever really been taught with any significance that the cord is in the column. So if this cord is very forward, what literally can happen is there's reduced function.
It's getting choked.
It's really getting squeezed very, very hard. So that spinal cord is getting choked, and that child could have breathing problems. They could have digestive problems. They could have seeing problems. They could have asthma because those nerves impact those organs. But see, what happens then is that over time, that neck gets stuck in that position. It is very difficult and very challenging to return back to the normal position. And you could have chronic health challenges because your spinal cord is not sending the message. Another epidemic that we're seeing is not only is the head going forward, but that mid-back is in a forward position. And what you need to grasp your brain with is that your lungs are going to be compressed. If your lungs are compressed, you're going to have less oxygenation. If you have less oxygenation, you're going to have chronic health challenges, chronic colds, flu, etc., because unfriendly organisms do not like oxygen. So over time, you're going to have challenges that are going to occur in your body. So whether it be if you have a notebook, electronic notebook, a computer, or video games, it's going to negatively impact you if your head, because your head literally becomes into this military neck kind of position, and it's going to impair function to the body. Something else that we've noticed with more and more children, and we've seen this as a transition occur over time, is that we'll have children that when they're young, their curve could be normal, but if they are doing a lot of book reading and what I just said with a tablet or smartphone, even book reading, you have to change the position. So if you're at work and you have a screen that's here, make sure that your screen is allowing your neck to work comfortably. If you have a book, change the position. You might want that book at eye level, but if you're going to be putting a lot of time, especially if you're a student, with your head in that down position, it's going to impair function.
You know what, Dr. Bob? I notice when I sit at my computer and I have a lot of work to do on my computer that I have to almost stop and evaluate my posture. Because you can become just like this and start working your computer keyboard because you know you might be more slouched, you might have been there a long time, and I have to actually sit myself up and type in more of a what should I say, erect position.
That's exactly right. And I think, Debbie, also, this is just a thought for those of you that are watching us this evening. Right now, the way that the spine is gravity is working with the spine. That means if I had a bowling ball up here right now, gravity is pushing down very evenly throughout the entire spine. Think about this concept. If you put this spine in the forward position and you put a 10 or 12 bowling ball, which is your head, on top of the spine, gravity is now working against you. I'll say that again. You want gravity to be working with you. If your head's in a forward position, gravity is working against you. You could have constant, relentless numbness in your hand and poor function of your body because of poor mechanics caused by texting, spending a lot of time on the phone, numbness in your hand, challenges sleeping also.
What about the dual, Dr. Bob? What about somebody texting, and it can be an adult, like traveling, and a backpack on?
Well, that's almost like a double trouble, Debbie, because what you just said, if you're going to have this backpack and your head's already in a forward position, and then you're adding texting to the component, it's definitely accelerating. And I know that recently I was at an event and I saw an old-time friend. I hadn't seen him in years, and I was just thoroughly amazed by how forward his posture was. And I know a lot of it was the fact that he had poor mechanics. I'm not saying it was all because of poor reading styles, etc., but it affects someone in a negative way because your cord is in the column. So let me give you some takeaways that are very positive and very healthy. There are 3 things that you really want to do on a consistent, regular basis. Let's say that there's a door jamb right here. You know, the 2 pieces of wood on either side of the door entrance? You could put your hands about shoulder height and lower your body into the door. By doing that, you want to feel a pull or tension in between your shoulder blades. If you did 3 sets of that every day, 15%, so you go 1, 2, 3, 4, 5, release, 1, 2, 3, 4, 5. If you do 3 sets of 15 every day, you don't want to feel it in your chest. You want to feel it between your shoulder blades. That's going to start to tone the muscles in between your shoulders. That's going to give you this conscious effort to think uprightly. The next thing you want to do is get a large exercise ball. Usually I promote about a 55 centimeter ball. Why is that for? Well, that's about the size of a ball that you could very gently and easily lay your back on top of. So you're going to have the ball and you're going to be laying down on top of the ball with your head here. do that 2 or 3 minutes, 3 or 4 times a week. If you're doing a lot of sitting, I would do that anywhere from 2 to 5 minutes per day. And then what you could add to that is a 2, 3, 5, or whatever pound weight you want to do, and put that as an overhead, because see what that's going to also do for you, it's going to tone those muscles, because we have to do all this neck reverse curving. Now I'm going to share a little head slide that I'd encourage all of you to do. What I want you to do, and I'm going to turn my head perpendicular here to the camera, is you literally want to take your head, I like to close my eyes to take away distraction, take your head back like I'm doing right now, and then take it backwards like this, and hold it for a 5 count. You don't want to just take your head back, you want to take a slide and head back. The reason that you're doing that, you're holding it for a 5 count, you can do 25 of those every day. The purpose of that is to actively reverse that head position, putting a demand on the muscles so they'll contract, so they'll get used to it. Because see, this takes no effort to go forward. This takes energy to come back like this. Your purpose, your goal is to get that head backwards over your shoulders, okay? Now, another area that we see challenges with is that we see challenges that when you're just standing. So you need to have a conscious, purposeful awareness of where your shoulders are at. So I know oftentimes I'll encourage especially my younger patients to stand upright and put the palms of their hands on their low back, as in a military position. You don't make a big deal about it, you just assume that position. So what I'm trying to have you do now is be perceptive of your arrangement to gravity and to how you're standing.
I'm going to give a quick challenge to all of you viewing. Get a partner and evaluate where your head position is. Is it over you? Is it forward, or is it behind? Because you might want to take a different type of look at your health coming from your spine.
And I think that your posture is the window to your spine and your nervous system is. As your posture is how your function is going to be. And I know that it seems like, how can my posture affect my body, Dr. Bob? If your head, these are the lungs, if your head and your shoulders are forward, your lungs are going to be compressed. So if you're going to be doing some texting, change positioning. You might want to sit down, you might want to stand up, but you want to get your head backwards, because see, over time, it's going to impair function. And if it gets to a point that you're starting to get numbness and headaches and even heart palpitations, it's very logically possible that it could be coming from the altered curve in your neck. Vary the position of your books. I know that when I read my Bible in the morning, I use a tablet today. I'll hold that tablet in front of me. I'm constantly changing positions. You might want to, depending on where you work at, is literally move your monitor. If your monitor is in the front, you might want to move it to the side if you can. If you have the ability to move your monitor around, it's going to affect biomechanics. My concern, though, today is for little children that I'm seeing anywhere from 3 to 12 years old. And these are habits that if they start as a youngster with their head like this, and I want you to start looking around. Because if you look around and you're starting to see these people with this very head forward position, and they have this chronic cough and they have all this going on, I know it might